Thanks very much, Cathaoirleach. So, Minister, my first question is to ask you in relation to the actions that your department has taken to address disadvantage in early years and childcare settings, and if you'll make a statement on the matter, and I'll expand further in my later time. Thanks.
Thanks very much, Chair. Good morning, Deputy. I'm committed to tackling disadvantage through high-quality early learning and childcare that's affordable and accessible. The ECCE programme, which enjoys uptake rates in excess of 95%, has removed barriers to accessing preschool education, with data from the Growing Up in Ireland survey showing that more than 60% of low-income families would not have been able to send their child to preschool without this programme. In addition, the National Childcare Scheme, the NCS, through a combination of universal and targeted subsidies, as well as sponsorship arrangements for vulnerable children, is substantially reducing the out-of-pocket early learning and childcare costs for families, with the highest levels of subsidies available to families on the lowest incomes. Record numbers of children, more than 93,000, are currently benefiting from the NCS, 38,000 more children than this time last year. Moreover, the number of providers offering the NCS has increased by more than 10%, owing to contractual conditions underpinning the new core funding scheme. And evidence attests to the effectiveness of the NCS. Indeed, recent OECD data shows Ireland's performance in supporting families, and particularly lone parent families, with the cost of early learning and childcare is markedly improving, with Ireland having the highest decrease in early learning and childcare costs to families across the EU over the period of 2019 to 2021. And in 2021, net childcare costs as a share of households' net income for lone parents and low income fell below the EU average. This data does not take account of the very significant enhancements to the NCS that have been funded under Budget 2023 and will kick in from the 1st of November this year, nor does it include the impacts of core funding and the fee freeze. In line with the commitment in First 5, officials in my department are currently progressing the development of a new strand of funding tackling disadvantage, whereby services will be provided with a proportionate mix of universal and targeted supports to support children and families accessing their services. Officials will soon engage with stakeholders on this work, and just as one final piece of information, they will shortly pilot the provision of a hot meals programme in early learning and childcare services as one potential support.
Thanks, Cathaoirleach. Thanks, Minister. So that end piece there, I think, is very important in relation to that new strand of funding. Because the reason I raised this question is we were contacted last week by people when they heard the announcement of the 75,000, I think, for disadvantaged, or sorry, the 54.5 million funding that was announced to tackle disadvantage, and there was, well, it was welcome. I think talks of a garden at Bloom that just angered some people, and I'm talking about some really good, committed early learning, early years sector that are have been so engaged with the core funding, welcome the core funding, and have been at this for years. And there are some of the people that we would have spoke about before in relation to when there was a change, and that was welcome. With the hours, remember we spoke about that a number of times for ECC and for the school hours being taken into account. But could you expand a bit on that new strand of funding? Is that separate to the 54.5 million, or is it included in that? And also there is some really good people engaged in this that I think would be really beneficial for your department to speak to, that are very positive and that have very good solutions if there is going to be engagement with that sector. Thanks, Carla.
Deputy, apologies. I'm not sure that 54 million. You might just clarify with me in your what that is. I'm not. Yeah. That's not from my department. As I think I'd probably know if there was 54 million coming out. So no, I don't think it's not for ourselves. Yeah. So no, that's not linked to the tackling disadvantage. Yeah. That's separate to that. As you say, we've a work programme, and I recognise very early on, and you know, in fairness, you'd raised it with me in terms of the issue around the wraparound hours. We did act in that in our first budget. The last budget has and the last two budgets have been focused on core funding and the delivery of the NCS investment, which I think we all agree is welcome. Now we need to work on two other issues, two big priorities for me: the tackling disadvantaged strand, and also looking at AIM and seeing can we broaden AIM out. And those are both two really important issues. So my officials will be engaging with relevant stakeholders, including many of the people you spoke about, in terms of how we can properly design that tackling disadvantaged strand and how it will operate.
Thanks, Caoirleach. Yeah, no, I welcome that in relation to AIM as well, even though that's not part of the question, but it is a really vital service, and we often do hear if that can be expanded. But definitely, there is a need, I suppose, in some sectors, and obviously it depends as well. You know yourself, there are some areas that there is this very high disadvantage, and maybe 90% of the children attending, parents are not in employment, and there's kind of various maybe issues and stuff. So it's really, really important that there is additional funding, because I suppose the core funding and elements of that are really welcome. But some people, I suppose, think that the older model, the CCSP, maybe for the disadvantaged, was slightly more beneficial. So if there's a way of kind of combining or looking at additional funding for disadvantaged, I think that is really the answer. Is there a time frame? You might have said that and I missed it, but is there a time frame for when you're going to commence that? And the hot meals that you spoke about, is that like a pilot? We'd obviously welcome that. And Carlo Kenny, if you want to try us out for a pilot. Thanks.
Margaret.
Thanks. So the hot meals is a pilot. We won't be. I don't think we'll be able to have it as universal application in its first year. But it is to look at, as you know, the hot meals are provided where children are in services for a full day. But this is to look at children maybe in sessional services during the 3 hours, to make sure that they would get a hot meal, either maybe a breakfast or a lunch as well. And that's something we're looking to pilot. In terms of the tackling disadvantage, and I think one of the key things and why I referenced AIM is that, as you know, AIM has targeted levels of support, recognising that not every service needs the same level of support. And I think that our tackling disadvantage scheme will be closer to that than maybe the DESH model, because DESH is kind of all or nothing, whereas this model, AIM, recognises some children in some schools need a lot of support, some need some support, and I think if we can design our disadvantage scheme like that. So look, over the next year we'll be working on that. There is some more work to do on it, Deputy. It's not ready to roll right now, but that work is starting, and I think that'll be a valuable addition to our supports for services, but most particularly for children.
Magadara, Pugmadarigadi, and Keshtella, Kesht, Ibrashaskashay, and Anaman, and Takta, Verona Murphy.
If I could ask you, please, on what date will your department take control of the Community Specialist Disability Functions, CDNT, the Children's Disability Network teams, and if you could give me the information?
Thanks, Deputy. So in announcing the formation of government, as you know, the Taoiseach announced his intention to have the coordination of disability-related issues handled by a senior minister for the first time, and the location of disability equality policy, which had previously been in Justice, and specialist community-based disability services in health in a single department will facilitate strategic policy development, including implementation of the UN Convention on the Rights of Persons with Disabilities that Ireland ratified in 2018, as well as the very significant reforms envisaged under the Transforming Lives programme. Under the Convention, and following the transfer of the equality function, my department is both the national focal point and the coordinating mechanism for implementation of the UNCRPD, and consolidation of the disability function represents a significant opportunity to further the progressive realisation of the Convention in Ireland. It's a really significant transfer of functions, both from the point of view of improving services for persons with disability, but also from the perspectives of both departments. My priority has always been to ensure that that transfer can happen in a seamless and an effective way, so that services are maintained and enhanced, and that all the appropriate governance and financial arrangements are properly put in place. At this time, our two departments were working with the Department of Public Expenditure and the HSE. We're finalising the financial governance elements, and those were the final elements that need to be addressed. And we will look to be bringing forward a memo shortly to government to finalise and provide that date. As I say, it's a really significant transfer of functions. There's a budget of 2.4 billion transferring from health to my department. Responsibility for so many crucial services, whether it's residential services, the community disability network teams, all of those will continue to be operated by the HSE, but the accountability element will be within my department. It's taken too long. It has taken too long. We all recognise that, but we are close to the end of that process now, and close to the situation where it will fully transfer to my department.
Margaret.